Well, right now we'd like to welcome Dr. Allison Brooks, and she is with Hoag, the Women's Health Institute. Nice to have you on today.
Good morning.
Welcome. So describe the kind of the reason for the Health Institute and what are some of the things that you offer. We know now you have it as well over here at the new Irvine location, right?
Right, we're very excited about the grand opening of the new Hoag Health Center in Irvine on Sand Canyon, primarily because it offers the full complement and array of both primary care and specialized services, so that we can actually deliver the care where people live and so they don't have to travel and make it more convenient for them.
Right. So what are some of the things you're going to be offering there as far as the Women's Health Institute goes?
So in terms of the Women's Health Institute or Women's Services, there's a full cardiac rehab program.
Okay.
There's a comprehensive breast center that offers everything from the screening services for breast imaging as well as diagnostics and surgery. There's a very impressive and pretty novel and unique pelvic health center that is called Womenology, where we provide physical therapy as well as Pilates and yoga, guided imagery, acupuncture, a variety of non-surgical offerings to manage pelvic pain and prolapse and other things that are very common later in life.
Very nice. Now, as far as somebody taking advantage of this, would this be at first through their primary care, or is this something in addition that they can look into on their own? Especially when you talk about the pelvic health and the Pilates and all that kind of stuff.
So the idea of all of the offerings that are on Sand Canyon for Hoag, it's intended to be as a health village that offers on one side of Sand Canyon the emergency department, the hospital, Hoag Hospital Irvine, as well as the Hoag Orthopedic Institute, and a medical office building where many of the primary care physicians have office space. And then on the other side of Sand Canyon is the actual health center that has 4 different buildings. Each building has kind of a different theme to it. So one is really for cancer care. The other is for women's services, as well as specialty care with general surgeons, urologists, breast surgeons, and then there's an entire imaging center and linear accelerator for radiation treatments. And the what I get most excited about is some of the ancillary services. So there's an urgent care center right there, a beautiful pharmacy that does compounding, a very nice cafe called Mustard Cafe, and they actually, one of our donors was nice enough to donate a couple of golf carts or shuttles that take patients between each of the buildings.
Oh, that's nice. So
even though it's a small campus, just to help them wayfind and to navigate and make it a little bit more convenient.
That's very nice.
Yeah.
So
we really like
very
that.
Good. So you've been with Hoag for a while now, right?
Yeah, 24 years.
Wow. And as you said right before we got on, you were practicing as a doctor. You still are a doctor, but you were more at the end of overseeing a lot of these services, right?
Right. So I was an OBGYN practicing for 23 years, and then slowly kind of moved into my commitment to leading the Women's Health Institute, and then most recently as the Chief Quality Officer.
Nice. Now, the Women's Health Institute, is that something new? Has it been down at Newport for a while and just new here?
Right. So it's been, we've had a Women's Health Institute for 7 years now. But primarily I would call it in some ways a virtual institute, in that the goal is to bring women's services, the full complement from preventive to specialty services, out into the communities. So our kind of mothership is in Newport, but we also have really comprehensive health centers in Huntington Beach, as well as Aliso Viejo, and now Irvine, and then soon to come will be one in Tustin.
Oh, nice.
Right.
Very good. The one up on Irvine, right up there on Sand Canyon, very convenient location, and as you said, it's offering a whole lot. Obviously, the Women's Health Institute is there, but it's really come on to, as you said, serve the community
Right.
and have the ability to work, I think, a little closer to patients, certainly both physically, because they don't have to go down to Newport or somewhere else,
Right.
but also, I think, more one-on-one as well, right?
Well, we really have designed it, done a lot of work in asking the community what they want, what they need, and where the gaps are currently.
Yeah.
And we've tried to make it more patient-centered and friendly for them. So a big part of it is helping them coordinate the services that they need, get them to where they need to get their care, and in many ways offer sort of a one-stop shop, or at least a one-stop campus for those healthcare needs.
Very nice. So again, to take advantage of this, would somebody go through their primary first, or are there certain things you offer there that if someone's interested in, they can just call up and find out more about?
So generally, we typically encourage everyone to use their primary care physicians to help coordinate and be the quarterback for their care, and certainly to be involved and they know them best. But women and men actually can self-refer. Specifically for womenology, they can self-refer.
Okay.
And some of the services there are on a fee-for-service or a cash basis. Others are covered by insurance. And I think that while we offer multiple entry points, I still think that to have it coordinated through the primary care physician makes the most sense. All
right, very good. I do want to give you both the phone number and the website. The phone number is 800-400-HOAG or 800-400-4624. And the website is hoag.org/women's health. Dr. Allison Brooks, thank you.
Thank you very much.
Nice to see you.
Thank you
and
for
it's
having
great
me.
that you're heading up this, and you're right up the street, so not bad at all.
All right,
Pleasure.
thank you.
Bye-bye.
Bye.
We'll be right back.